Welcome to the Deep Dive. Today, we're getting really specific just for you. We're going to be talking about fertility blood tests and what the results can mean, especially if you're looking at options in the Bearsden area. We've been looking at the excellent guidance from the experts over at Blood Test UK, and we've boiled it all down to what you really need to know.
Exactly. Our whole mission here is just to make this stuff simple. We want you to understand what those hormone measurements actually mean so you feel, prepared and informed.
Okay, so let's unpack that. Someone goes in for one of these blood tests, they get a piece of paper back with all these acronyms, FSH, LH, AMH. What's the main thing these tests are actually looking for?
Well, what's really fascinating is that you're getting a snapshot. It's like a picture of the communication system between your brain and your ovaries.
The communication system. Oh.
Yeah, and while there are a few hormones, the two rock stars really are AMH and FSH. AMH is so critical, it doesn't jump around much, and it's basically the gauge of your ovarian reserve.
Ovarian reserve, so that's how many potential eggs you have left.
That's the one. A low AMH level, for instance, can signal that your ovarian reserve is diminished. And knowing that changes everything.
Okay, so you hear that term a lot, diminished ovarian reserve.
Yeah.
What does that actually mean for someone looking at their results?
Right. So if you see high levels of FSH, but at the same time you have that low AMH, it's a sign that the brain is working really hard, like it's shouting at the ovaries to release an egg, but the ovaries aren't really responding.
So a sign of a struggle.
It's the chemical evidence, yeah. And that insight tells you not just that you might need treatment, but specifically which treatment might work best.
And this is where it gets really interesting for me. How does having that specific data actually lead to a better outcome?
Well, this is what Blood Test UK makes so clear. This knowledge is fundamentally a planning tool. The results help your doctor create a completely tailored treatment plan. I mean, timing is everything with procedures like IVF or IUI.
Okay, so it's less guesswork and more precision.
So much more precision. If doctors know your exact hormonal window, they can time an egg retrieval or an implantation perfectly.
That makes total sense. It sounds like a roadmap, really.
Okay.
But for a roadmap to be useful, it has to be accurate, right?
Yeah.
What are some of the simple things that could, throw the map off course?
Oh, accuracy is key. And that brings up a really good point. What can actually change the results? First off, timing is just vital.
Okay.
These tests are almost always needed right at the start of your cycle, usually between day 2 and day 5.
And why is that?
Because that's when your hormones are at their baseline, their most stable state. But even beyond that, things like high stress,
right,
or even intense exercise right before the test can have an impact, and definitely certain medications.
Like hormonal contraceptives.
Exactly, they can really skew the results. You want the truest possible picture to work with.
That lines up perfectly with the advice from Blood Test UK. They really stress that preparation is key. Things like checking if you need too fast, or just being open about any medications you're on. That ensures the data is as good as it can be.
It's essential for an effective plan.
So let's wrap this up. What's the big takeaway here for you, our listener?
I think it's that these tests offer more than a simple yes or no. They give you a clear, personalized path forward.
It's highly personalized care then.
Absolutely. And research shows that having this clear hormonal assessment can significantly reduce the time it takes to get a diagnosis. It just enhances the treatment personalization and ultimately improves the outcomes for people there in Bearsden and beyond.
Okay, so a final thought for you to explore on your own.
Yeah.
Experts are now starting to look at combining these hormone tests with advanced genetic testing to give even more tailored advice. So the question is, how might understanding both your hormonal landscape and your genetic predispositions change the whole future of family planning in East Dunbartonshire?